Right now, the Arizona Department of Corrections is facing its second $1 million fine in 3 years for healthcare practices that are below standard. U.S. District Court Judge Rosalind Silver issued the ruling late last month. Cronkite News reporter Katelyn Keenehan tells us the timeline of events that led up to the fine and what the next steps are for the ADC.
The problems within the ADC's healthcare system are nothing new. The legal analysis of these issues dates back to 2012 with the filing of the Parsons versus Ryan's lawsuit. The ACLU acted as the plaintiff, citing healthcare concerns in all 48 facilities operated by the ADC. In 2015, the lawsuit was settled after 3 years of fighting allegations in court. 112 healthcare benchmarks were established, and the ADC agreed to 70% compliance. In 2018, Judge David Duncan fined the ADC $1.4 million for noncompliance to the measures put in place by the court. At the time, the department successfully blamed their private healthcare provider, Corizon Health. Corizon paid the fine. Due to the issue, the Department of Corrections changed private healthcare providers, offering a new contract to Centuron for $204 million a year. Now, it's 2021, and U.S. District Court Judge Rosalind Silver is laying down the law. She fined the department $1.1 million for failing to meet milestones in the month of February. Some of the main issues: timely medical attention, lack of mental health services, and critical care units.
Bill developed a heart problem last July.
Deborah North's husband, Bill, is incarcerated in the Kingman complex in Mojave County.
They moved him to what is known as a critical care unit,
where the ADC also treats COVID-19 patients.
Everyone in that facility developed COVID, my husband included.
The measures of noncompliance that they need to address span virtually every aspect of healthcare. It has to do with medications. It has to do with people who are in infirmaries because they're very, very sick.
In the lawsuit, the ADC said the discrepancy in care was due to the transition from the old healthcare provider to the new one, Centuron.
I think there's plenty of blame to go around.
I watched people die in front of me.
John Fabricius, who was released in 2018, dedicated his life to helping those still inside. He says privatization makes it challenging to point fingers.
The Department of Corrections can say it's their fault, where the private company can go, no, it's their fault. And then at the end of the day, they're all, well, I don't know whose fault it was.
But the court isn't taking excuses, and neither are those who have felt the impact of the noncompliances.
How are they being allowed to neglect the people who are in their care?
In previous years, advocates gathered here at the Capitol to read a list of names of people who died in correctional care. However, this year, due to the ongoing pandemic, the vigil took a virtual route.
Benjamin Madrigal.
And the list of names got even longer.
Francisco Almeida.
Loved ones say some are at the fault of the ADC healthcare system.
Melvin Tedder.
But Fathi thinks progress is around the corner.
I think the rubber may be about to hit the road. Judge Silver has given notice that the state is potentially on the hook for up to $17 million in additional contempt fines. And finally, we may see a lasting solution to this long-lasting problem.
The court ordered the ADC to explain their noncompliance to 170 performance measures by March 26th. The Department of Corrections said they received the order and are reviewing it with their attorneys. In the studio, Katelyn Keenehan, Cronkite News.